managing our Q&A section. For those new to our organization, Young Survival Coalition, aka YSC, is the premier international organization dedicated to the critical issues unique to young women and breast cancer. YSC was founded by 3 women diagnosed with breast cancer all before the age of 35 and has since built a powerful community of breast cancer in young women. Today, YSC offers a wide range of resources on the medical and emotional issues that these women face. They have been available, the Metastatic Navigator, newly diagnosed resource kits, support groups, and events, as well as our annual conference for young women affected by breast cancer, called C4YW, which will be held with our co-host Living Beyond Breast Cancer this February in New Orleans. We provide outreach services through our many affiliates across the country. And if you'd like more information about Young Survival Coalition, please don't hesitate to visit our website at youngsurvival.org. I'm also pleased to have our co-host, Cancer Support Community, which is an international nonprofit dedicated to providing support, education, and hope to people affected by cancer. In July 2009, the Wellness Community and Gilda's Club Worldwide joined forces to become the Cancer Support Community. Today, CSC provides the highest quality emotional and social support through a network of affiliates, satellite locations, and online. Most recently, CSC updated its Frankly Speaking About Cancer, Advanced Breast Cancer book, which includes a section specifically on young women with advanced breast cancer. For this book and other program offerings from CSC, please visit their website at cancersupportcommunity.org. YSC and CSC are so excited to be working together on this webinar, which grew out of a survey of young women with metastatic breast cancer. The information covered in this webinar, such as managing side effects, living every day with the best quality of life, asking for help and communicating your needs, connecting with other young women living with METS, and relationship and intimacy were all top concerns identified by survey participants. We are so pleased to have a wonderful speaker joining us for tonight's call, Dr. Sage Bolte, an oncology counselor with Life with Cancer, part of Inova Health System in Fairfax, Virginia. Sage holds a PhD in social work and has extensive experience in the individual and familial impacts of metastatic breast cancer. Before we start, I just have a few housekeeping items. You may access the audio for this event one of 2 ways. Either turn on your computer speakers to use the computer sound system or use the dial-in information and PIN found in the webinar user screen to your right. Click the plus sign next to the audio if you cannot see this information. Choose your audio option by clicking the round button next to telephone or mic and speakers. Tonight's call will be recorded and made available on YSC and Cancer Support Community websites. The format of tonight's call will be as follows. Our presenter will be featured first, and then we will begin the question and answer portion of the evening. To ask a question, please type it in the question box you see in the webinar user screen to your right. You may submit a question at any time during the event. We will use the time allotted at the end to answer as many questions as possible. If you want to ask a question anonymously, please note that when you type in your question. If at any time your webinar user screen disappears, click the red arrow at the top left to expand the screen again. Before you close out of the webinar, you will see a link to complete the post-event survey. Please know that your input is extremely valuable to us. The survey will only take you a few minutes, but it will really have impact. It is now my pleasure to introduce our featured speaker, Dr. Sage Bolte. Sage joined Life with Cancer in June 2004 after completing 2 years of psychosocial oncology research and patient care at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins University. Sage was tasked with developing a program that specifically addresses the needs of the women, men, and families impacted by metastatic breast cancer. She provides individual, couples, and family counseling and facilitates several support groups, including the breast, metastatic breast, and young adult groups. Her areas of interest and expertise are sexuality and cancer, and the various issues that face both those with metastatic cancer and the young adult population. Sage has presented at local, regional, and national conferences on the impact of chronic illness in ways that people affected by cancer and healthcare professionals can address common problems. She received her master's in social work from the University of Michigan and graduated in 2010 with a PhD of social work from the Catholic University in Washington, D.C. I'll simply say that Sage is a good friend to both organizations, and it is our pleasure to have her. Sage?
Thank you so much, Stacy. Really appreciate it. And thank you to both CSC and YSC for having this talk. I know we're all anxious to be engaging and create a community within each other on the call tonight. So I look forward to answering any questions that come up. I just want to state first that I have no relationships with the sponsor of this program. So obviously I need to put in that disclaimer that I am in no relationship with both the YSC and the CSC other than as a speaker. And we're just going to figure out how to move the slides forward, and we will get moving. Bear with me for just 1 second. I don't see the... Well, I guess whoever's on the other side controlling slides, if you could just go ahead and hit slides for me, we'll just go that way at this point. Great. And go ahead, one more. So we're going to talk about understanding advanced breast cancer, and I think it's important to first just kind of define what advanced breast cancer is. We throw around the word metastatic a lot and advanced breast cancer, and I think it's important just to understand that when we're speaking about advanced breast cancer, that this is cancer that has spread from the place where it first developed in the ducts or the lobules of the breast. So it's gone to a different part of the body. Other names that's given it is metastatic, as we said, or stage 4. And some women are diagnosed in earlier stage breast cancer and then have a recurrence that is metastatic. Others are diagnosed with stage 4 or metastatic or advanced breast cancer. When we're going to talk a little bit about the importance of partnering with your healthcare team and some of the steps you can take to improve your relationship with your healthcare team, as well as questions that you might want to ask of them in developing your healthcare team. I'm sure there are a lot of you on this call that have been doing this for a while, and there's probably several of you that are new to this disease and kind of how to develop relationships. So we want to talk about developing the best team for you. Really and truly, I think what's really important is that it is so critical that you feel respected and listened to by your healthcare team. This is a lifelong relationship. This is something that you'll be kind of in and out of treatment with, and it is so critical that you trust your doctor, but not only trust them, you feel heard and respected by them. And remember that there's no one way or right way to treat advanced breast cancer, so there may be various ways that if you're in a support group, one woman you might hear may be receiving one treatment and another woman might be receiving a different kind of treatment. Remember that this is where trusting your doctor and being engaged in a relationship with them is really important, so that you can ask questions if you're concerned that you're not getting the right treatment or the treatment that somebody else in the group or someone that you know is getting. That's also important to remember that there are really good times when a second opinion might be beneficial. A second opinion can be beneficial both from either seeking it out from another physician in the practice or going to a different practice to seek out a second opinion. And remembering, again, that even if you get a second opinion, you also have the right to get a third opinion, fourth opinion, whatever opinions that you might like. I want to inform the other speakers that somebody is not on mute, so we're hearing a lot of background noise. If somebody could make sure that it's muted, that would be great. Thanks. So again, you have the right to get a second and even a third opinion at any point during your treatment. It doesn't mean that you need to replace your oncology team, but at some point if you feel like you're not getting all the information, or maybe there's a clinical trial you'd like to explore, it's always your right to get that second or third opinion. It might also be beneficial in developing your relationship with your oncology team to ask when a palliative care team referral might be helpful or appropriate. I'll talk later in the talk about the difference between palliative and hospice care because I think unfortunately they get grouped up a lot and they're very different. And oftentimes we now believe that palliative care is an essential part of a person's diagnosis from the very beginning because they can help manage some of the symptoms and side effects that maybe your oncologist might not know how to address in a more global perspective. We'll go to the next slide. In talking about managing side effects, there are lots of side effects, as I'm sure many of you know, and it's important to note that not everyone experiences every side effect. So some drugs do not cause hair loss, other drugs do. And I think in speaking to side effects, what's really important and also creating a relationship with your team is that you feel very comfortable telling your team what is kind of a deal breaker for you as far as your quality of life. If losing your hair is really important that you keep your hair, that would be something you'd want to have a conversation with your doctor about. That does not mean you're vain. It does not mean that you don't value your life. I'm thinking of a conversation I recently had in a group where a woman really is very committed to not losing her hair, and so her and her doctor have gotten very creative about treatments that avoid hair loss. If at all costs, they can avoid a hair loss. So again, reporting any changes to your physician, whether that's a change in nausea, vomiting, your appetite changes, even if you think they're insignificant or you think you got a flu bug or something else, it's really important that you report those side effects and or changes that you experience so that they're monitoring you well. There are a lot of amazing medications out there that we can do a good job at helping you feel the best we can. Our goal in treating advanced breast cancer is to make sure your quality of life is as high as possible. So if you're experiencing side effects that impact your quality of life, report them to your doctor to get a handle on them so that we can get creative about how to treat those. Certainly there are some side effects of medications that can cause changes in organ function. And this would be very important information that you know, not only so that you can relay it to your primary care physician, but information that you will know so that you can make sure that you're tracking that along with your oncologist and know the risks and benefits of the medications. Neuropathy is also a side effect of many of the medications. It causes that pain and tingling in your hands and feet, and it can go from mild neuropathy to pretty extreme neuropathy. Some neuropathy can create permanent damage and can't be reversed. So if you start experiencing it, it's really important, even if it's a quote-unquote normal side effect. Really important that you report it to your doctor so that they start monitoring it. There are some great things that can be done to help neuropathy, including medications that can be given. In addition, we found help with acupuncture can be helpful, massage to the hands and feet, and even some Epsom salts baths can be helpful to your hands and feet as well in helping relieve some of that discomfort of neuropathy. It doesn't fix the neuropathic or the neuropathy pain, but it can relieve some of the discomfort. And of course, we all know about hot flashes and how uncomfortable and frustrating they are, and that can be a side effect of most medications. Really, it's not a side effect of the medication, but it's a side effect of menopause often. And if you've been put into a medical menopause or chemotherapy is keeping you in menopause, the hot flashes are there and can be very intrusive in your quality of life. So again, reporting that to your doctor would be important because there are also medications we can give to manage that. And there are also homeopathic approaches. There's been great results with acupuncture with hot flashes as well. So exploring some of the other options for you to manage hot flashes would be an important step for you. Other side effects that people can experience are things like low blood counts, which may affect your energy level. Your doctors probably go over what they call the CBC with you, and you want to just understand that. It's really important that you are informed and up to date on what your lab values reflect, because that can be information for you and empowering for you to know where you're at, what you need to be cautious of. If your counts are really low, you need to be careful around people, especially during flu and cold season, being mindful about washing your hands, washing grocery carts, etc., so that you can maintain your healthiest during the treatments. We also know some of the side effects don't just affect our physical body, but also our emotional self. It can create cognitive changes, and whether that's chemo brain, as we often hear, or it's what other women might describe as the menopausal fog. Also, depression can set in. We know that people diagnosed with cancer are 15 to 25% more likely to experience some kind of emotional distress, and that's really normal. So if you notice a change in your cognition, your ability to concentrate, if you notice a change in your mood, if maybe you have a loved one who notices a change that you just seem to be up and down a lot, or maybe you're more down or depressed, that's really important to bring up with your trusted healthcare professional, whether that's the nurse practitioner, your oncologist, your primary care physician, if you have a psychiatrist or psychologist or a social worker within your institution. They can be one of the other side effects. Again, one of the microphones has been turned on, so if you're on the panel, if you could please use your microphone. Thank you. So another side effect that some people experience are fatigue and sleep habits. So the reason that we talk about sleep habits and fatigue is because oftentimes, although chemotherapy and low blood counts can cause fatigue, if you don't have what we would call good sleep hygiene, you can also kind of feel like you're constantly battling fatigue. It's also important to know if you're experiencing fatigue or if you're depressed, because they often look very similar. So talking to your doctor about that would be important to help differentiate between those two. What we mean by sleep hygiene is getting yourself in a regular sleep habit. I know that's challenging for young women because we have jobs, we have kids, we have responsibilities, we have partners, we're going out, or whatever it is that we're doing. Sometimes our life gets very full very fast. But having a sleep hygiene routine, so at 10 o'clock, you know that it's time to go up, wash your face, brush your teeth, get in bed, don't turn the TV on, maybe read a book for a few minutes, turn the lights off, and go to bed. Your body starts predicting that routine, and it will help with you regaining good sleep hygiene and fighting that fatigue. We know that changes in sexuality and sexual function are a really common side effect of treatment. They're also a side effect of women when they experience depression and anxiety. So many women experience changes in this. Unfortunately, young women typically experience this to a higher degree because oftentimes you're forced into a medical menopause, and there are a lot of changes that happen both psychosocially or psychologically that can affect the way you view your body or your sexuality, but also physically. Chemotherapy is a drying agent, so it can affect vaginal moisture. It can also affect vaginal stenosis, or the narrowing of the vaginal canal. It can affect your libido. Both physiologically it affects your libido, but also emotionally. If you don't feel very sexy or you're very fatigued, that also might affect your libido. So again, something really important to report back to your doctor. With body image, you know, this is one of those topics that could take a talk in and of itself, but I just wanted to mention how important it is to honor that if there are struggles that you're having with changes in your body image, that seeking out a professional who can help you work on that would be really helpful. Because although your breast may not be restored and your hair may not be restored, there are ways to come full circle in feeling and embracing your body and some of that new normal or new image in a very healthy, helpful way that can also help improve your both sexual function and in just general help you feel better about your body. There are some great organizations out there and or pamphlets. The American Cancer Society has a great pamphlet called The Woman in Cancer, Sexuality in the Woman in Cancer and Her Partner, that also has some body image exercises as well as, again, addressing some of the sexuality and sexual function issues. There are other organizations out there that might be willing to talk to you or give you some support or supportive counseling around these issues. There are sex therapists through the aasect.org. And a lot of the social workers and institutions are connected to some of the oncology practices are very willing to have conversations about both of these topics to help you work through some of these so that, again, your quality of life can be greater. There are some other specialists that would be important to also bring into the mix, and that includes palliative or hospice care. And one of the reasons we include this in the slide is it's really important to know and have an honest conversation with your doctor about what the benefits of palliative care would be. And again, palliative care is really an extra added benefit of symptom management. They're the pain specialists. They understand fatigue related to cancer and cancer treatment. They understand comorbid things. So if you have diabetes or you have other issues that have come up, that are influencing your quality of life, they can take a really good global picture snapshot of you and help make recommendations to improve your quality of life. They're a fantastic team to have in addition to your oncology team, and include conversations with your oncologist so that both are really taking good care of you. At some point in this journey, there will be a discussion with your oncologist about hospice care and the appropriateness of hospice care. Hospice care is end-of-life care. It does not mean that when your doctor brings up the idea of hospice that you're now actively dying, but it does mean that it's important to start addressing the issues of end-of-life and end-of-life care. Sometimes it's very helpful for women to bring this up early on in their diagnosis with their oncologist, like saying, when will you make the recommendation for us or for me to go on hospice care? At what point do you make that decision, so that you're informed early on, and then you can just kind of leave it back in their hands? Or you can bring it up more frequently, whatever, again, style suits you. It is not an easy conversation for anyone to have, but if you have information, you can be more empowered on what decisions you need to make moving forward in your life to, again, get the best quality of life. In staying healthy during and after treatment, certainly we want to talk about nutrition and exercise. Nutrition is a great way to stay healthy during and after treatment. There is no right or wrong way, I would say, around nutrition, but it would be really important. Obviously, there is a wrong way. If you eat Burger King every day, probably not the best thing for your body. But it would be really good to seek out a nutrition expert, whether it's a dietitian or someone on staff that's a nurse that feels very comfortable addressing nutritional issues, so that you can have a better understanding of what's going to help you feel your best during your treatment. Exercise. Any kind of exercise you can do that you're permitted to do, obviously you need to listen to your body. If you have bony metastases that limit certain kinds of activities, make sure that you either seek out a physical therapist and or an exercise physiologist who understands cancer and its treatments and can give you some ways to adapt exercises so you still can get your cardiovascular activity in. Exercise is going to be important not only for the way you feel about your body, but the strength that your body needs to kind of keep the course and maintain treatments for the rest of your life, as well as fight fatigue. We know that exercise is a great way to fight fatigue. So any kind of exercise, again, whether that goes from yoga to a gentle yoga to a more active yoga, to running, to using an elliptical machine, to using light weights. Again, really important to know your own limits, but also asking your doctor for permission on what you can and can't do. Sometimes it requires us to adapt to new physical changes, and that may change frequently. Maybe you have muscle soreness or stiffness because of the chemotherapy, and you notice on days 4 through 7 that stiffness is really bad. So you might take a gentle yoga class that week, but maybe the next week you're feeling better and you could take a more aggressive or more harder yoga class, or again, maybe go for a jog or take another kind of class. Sometimes, again, adapting to the physical changes means that we also need to make adjustments in our own life. If you notice that taking a shower is exhausting, which for many women it is when they're on treatment, then don't make the shower an exhausting activity. Take a shower chair, sit in the shower, and use it as like a spa treatment, something that is refreshing and rejuvenating rather than something that's exhausting. Use your time and your energy wisely. If that means that you need to take a break in between things so that you can rest up and be ready, if it means you need to sleep in an extra hour, if it means you need to go to bed an extra hour early, adapting to the physical changes is an important part of your quality of life. And again, take some learning and some experience. Certainly we know that there are benefits of emotional support. We know that support groups make a difference in quality of life. We know that supportive counseling also make a difference in women's lives. Additionally, good family support and friends can also make a great difference in quality of life. So seek out the supportive people in your life who can really help you improve your quality of life and be of support to you. Identifying the things or activities that increase your happiness, like if being around your nieces and nephews, or maybe you have children and being around them increases your happiness. Maybe going to the beach increases your happiness. Increase the activities that bring you joy and decrease the things that don't, if that's possible. Again, sometimes going to work, it may decrease joy, but it's something that is a necessity, so it's not always something you can adapt. But maybe you'll use your time better on the weekends when you're not working and able to do the things that fill you up. If there are things that are keeping you stuck, and what I mean by stuck is I hear often from women this idea of fear, right? That fear keeps them stuck. It keeps them stuck in the past and fearing the future. If there are things that you're afraid of in the future, for one woman recently we had a conversation about her fear of dying and her fear of leaving her children. So we addressed that head on, because my philosophy, and this is, again, my bias, it's not necessarily true for everyone. I believe that if we can hit our fears head on and deal with them, process them, we are then able to move forward and let those fears go. So for her, one of our projects was working on letters to her children so that they could be done. So if something happened, not necessarily even cancer, and her life was cut short, that her children would have things that were meaningful to her and to them in the future. And it's amazing how just doing a couple things like that, a couple exercises like that, got her unstuck in fear, and she's able to now just kind of move forward and live in the present. Make sure that all of your healthcare teams are in communication. If you see a primary care physician, if you see an allergist, if you see a palliative care team, make sure that there is communication between all of those team members, because it's important that if there's any change in medication or if there's a change in your status, that people are talking and communicating. I want to move on to some of the other parts of improving your quality of life, and that's probably the hardest thing as women for us to do, which is asking for help. I don't know why our DNA says that we're not allowed to ask for help, but it seems like it's a constant challenge for us as women to ask for help. So I challenge women when I work with them to think about what would help free you up to do the things you love, and give those who want to help things that are tasking or tiring or fatiguing to you. If you love cooking, then your friends bringing over meals, although well-meaning, probably doesn't do anything in relieving your stress. But if you don't like cooking, them bringing meals over to help with the day-to-day can be very helpful. Are there friends who can pitch in with shopping, going to the grocery store, or cleaning? This is where using support networks or social media can be really helpful. So websites like Lots of Helping Hands or Care Pages or Caring Bridge can be great resources for you to help communicate what your needs are to your friends and keep them informed day-to-day of kind of how you're doing and what you're doing, and if all is okay and you don't need help, that you will let them know when you do in the future. Asking for help with childcare, whether that's just letting somebody come over for a couple hours so you can go do something you want to do, like get to the gym or go to the grocery store or clean the bedroom you've been meaning to clean. People are more than willing to help, so let them help with some of the basic things like that. Helping with the emotions. Again, one of the things I'm passionate about is when women are diagnosed with cancer, whether it's advanced disease or it's early stage, cancer brings up a lot of losses. And there is a really healthy and helpful way to move through those losses. So identifying and working through some of the grief and loss around how much this disease has changed, maybe your view of your friendships, maybe it's changed the way you view life and death, maybe it's changed the way you view your body, maybe it's changed the way you view the dying experience, and all of that is valid and important and really important to be processed and honored. So I would really encourage you to seek out a support group or a licensed clinical social worker or counselor who can help you work through that. There are great support groups online and face-to-face that you can seek out. The CSC has some. There are some outside of other organizations that you can find, and maybe just Googling or asking the nurse or doctor in your facility if there are any support groups locally. That would be a good place to start for you. There are some discussion boards that you can get on and kind of see how other women are doing. The only kind of warning I give to you is make sure these discussion boards are moderated by a professional. Some discussion boards can be a place where women go on and just kind of unload, and although that might be helpful to the woman who's unloading on the discussion board, it may not be helpful to you when you're seeking out help and feeling anxious. It might only increase your anxiety, so make sure you use that filter wisely. And again, therapy is a great place to go, whether it's getting individual, couples, and or family therapy to work through how to support you best, what their grief and loss is, because again, it's not just you who experience grief and loss, but those who love you also have some grief and loss related to this diagnosis as well. And that leads us into relationships with families, members, and loved ones. Certainly, there can be changing roles that happen. If your parents live locally, they may suddenly be way more involved in your life than they were prior to this diagnosis, and that may be a benefit at some point, and that may be not a benefit at some point. If you're in a relationship with someone, you and your partner may have some role changes that are happening because he or she is now taking more responsibility in the house, or he or she is taking more responsibility in maintaining employment and insurance, and that can cause stress in a relationship. So again, seeking out some support would be really helpful. Also, just honoring that the roles are changing and how you can work to still maintain your own identity in the relationship with your parents, or your own identity in your relationship with your children or niece and nephew or your partner is really important. Communicating with your partner and friends about your feelings and fears is also really important. So one of the things we often teach people is this technique of stating a fact, a belief, a feeling, and then what you want done about it. As women, we're really good about doing the first three things. We can usually say, you know, ever since my diagnosis, you seem to avoid talking about cancer with me, and it makes me feel like I think it's because you're scared that I'm going to get upset, and it makes me feel like you're isolating yourself from me. I think we do a really good job typically doing that with especially our partners. What we don't always do a great job is telling them what they can do next. So for that example, ever since my diagnosis, you won't bring up cancer or how I'm feeling or how I'm doing. I think it's because you're scared I'm going to fall apart when you bring it up. And that makes me feel sad because it makes me feel like you're isolating more. Then the next step, what I would really appreciate from you is that when we get together or when you call me on the phone at least once a week, you just ask me, hey, anything new in the cancer world? Or, hey, has anything changed with your treatment plan? So that, again, it gives them permission to ask, but also you're giving them what you need. Now, the task that would be next would be don't roll your eyes or criticize them when they do what you ask and say, oh, you're only asking me because I told you to do that. Yes, they are. That's good. That's a good partner or a friend who is listening to you and responded. In communicating with children, whether they're your own children or they're children that are in your family, some of the most important things you can do with kids is not keep them in the dark. Kids get very creative in their minds and can make up storylines if they don't feel like they're being told all the truths. They also listen when conversations are being whispered or if code words are used. So with your children or children that you're with that you have a close relationship to, one of the best things you can do is use the word cancer, talk about how the doctor's treating it, and tell them that if anything changes at any point that you will keep them informed, but that you're feeling great and doing well and the doctors feel good about how you're responding to treatment. And again, if anything changes, you will keep them up to date with those changes so that you've given them permission to ask, but also they don't need to spend time worrying about it, and you will keep them informed as things change. When we're talking about the intimacy, sexuality, or physical relationship with the partner, again, this is a talk in and of itself, so I just want to give you a couple nuggets. We know that cancer can change a physical relationship, both physiologically because of the treatments, but also emotionally. There may be strain in the relationship because both of you may be tiptoeing around things that you don't want to talk about or things that you're not talking about. It's really important to open up that dialogue. And also, if sex is important to you, then learning new techniques to help your body feel better, whether that's using lubricants, whether it's using clitoral heighteners that help with warming the clitoris so that your body responds and remembers what it was like to be aroused, whether it's doing some therapy around your body image, whether it's thinking of some ways to help improve your libido, like going on a romantic date and getting back to some of the basics of dating, can also be really important to help improve that intimate relationship. I also just want to emphasize, if your partner is no longer kind of initiating any kind of sexual contact, most likely it has nothing to do with their attraction to you or their desire to be intimate. Most partners, when they come to my office, say it's because they were afraid they were going to hurt you or they were going to come off as being selfish. And it's such a relief for many women to hear that it isn't about them, it's really about your partner and their own fears. So make sure there's dialogue about that as well. If you're single and you're wondering, how do I date and disclose about this disease? I don't have a magic wand. what I typically will suggest to women coming in is, what was your MO prior to cancer on talking about hard things in your life? We all have something in our closet, whether it's a crazy mother or something that happened to us in our early our adolescence or our young adult life that influences who we are now. When might you share that information? This would be about the same time you would disclose this. Now, if you don't have hair and you physically look different and so it's obvious that you're on treatment, then it's obviously something that you would disclose probably right away because it would be obvious. For many women, it's not obvious. So it's up to you on when you would want to do that. And being upfront and honest about it is only going to allow you to know if that person is willing to kind of hang in there and be with you, or if they're not. And if they're not, then it's better to let them go on their way earlier than later. The other thing I charge many women with is evaluating toxic relationships. If anything, cancer can give you permission to really kind of weed out the people that are toxic in your life. If they're relatives, it's a little harder, but if you have a friendship or a relationship with someone, and when I'm talking about toxic, I mean that person that drains you, right? They take everything from you and you get nothing back. You don't feel like your cup is restored from them. Children, it's different. We give and give and give to our kids and don't necessarily get that cup restored, but it's part of our role and we love doing that. This is a relationship where they suck you dry. It would be really important to reevaluate that relationship and make a decision on how important that relationship is to you in your current place in life, because what you want to focus on are things that improve your quality of life, help you feel strong, help you feel good, and keep you focused on the positive things in your life. The next part of the talks look on kind of transitioning in career and financial decisions. Excuse me. Oftentimes women will come up with a question around kind of how to talk to their employer about this disease. And I just want to refer you to one of the resources that are out there, and that's Cancer and Careers. There are other resources out there, but Cancer and Careers is a nice website to go to where you can kind of have a one-stop shop on how do I disclose to employer, do I need to disclose to employer, and what are my rights? So just so you know, you are not legally obligated to disclose to any employer that you have metastatic breast cancer. Obviously, if you need to leave for treatment, you need to disclose that you need to leave for a treatment, but it is not an obligation to reveal what you are leaving for. And there are a lot of great laws out there to protect you in that. So also knowing your disability rights. What are your rights? There are some places you can go, like the Cancer Legal Resource Center or the Patient Advocate Foundation, to find out what your rights are and what you are required to disclose to Human Resources, and or what you're required to disclose to your boss and or other colleagues or coworkers. And the answer to that is you don't have to disclose to your colleagues or coworkers anything. And you can ask that any information about your treatments remain confidential. There are some great resources, too, about managing the cost of cancer care through Cancer Care. Avon Cares, the Patient Advocate Foundation, and then obviously going through some of the pharmaceutical programs can also have some good patient assistance programs to help reduce the cost of medications. We know the cost of care can be astronomical at times, and it can add up. And if you aren't able to work, that may add another challenge to that. So getting information from your oncology team might also be of benefit to you. When you're exploring whether you would qualify for Social Security disability income if you're not able to work anymore, or if treatment is interfering with your ability to work full-time, that would be another place to explore, again, financially, how that would support you in your current day-to-day life and bills. Connecting with other women can also be a great strength and resource. So obviously, there's this great organization who's helping host this talk tonight, and that's the Young Survival Coalition. You can connect with other women, request to be paired up with someone. That's a great resource. There are other resources out there, local support groups through community support organizations. There's the Metastatic Breast Cancer Network. There's local and national conferences that are offered through many of the support organizations like YSC or LBBC. There's an organization called Emmerman Angels, which also will match you up with someone, an angel who's kind of a little further out in treatment, and try to pair the very specifics of your disease and where it's metastasized to along with your treatments to a similar match. And there's the organization I'm Too Young for This. That's for people diagnosed between the ages of 18 and 40 who also have a conference once a year and have a radio show and some online resources as well that you can connect with. So again, connecting with other young women and or maybe even having, if you're in a relationship, connecting with other young women and then helping your partner connect with another partner so that you both are getting support through this process can be really helpful and beneficial. So in conclusion, the goal of treatment for advanced breast cancer is to enable you to live for as long as possible with the best quality of life as possible. It is so critical that you be frank and open when talking to your healthcare team. So again, some people have a better relationship or a more open relationship with their nurse practitioner, even if they love their oncologist. Maybe you see your nurse practitioner more often. Make sure that you feel like you can communicate all that information, even if you think it's minute. Report that so that that relationship can stay informed and that they stay in the loop of what's going on with you. When you take a patient-active approach and participate in making treatment decisions that are right for you, you can improve your quality of life, whether this is asking for a palliative care referral, asking for a second opinion, looking at clinical trials, asking to change or look at different chemotherapies. All of those can be a patient-active approach and can only help improve your quality of life. So we want to open up the next 20 minutes or so to question and answers. We just kind of gave brief introduction and would love to have a dialogue with you all about any questions that you may have that we can answer.
Yep, and we just want to remind anyone who has questions to please use your pane to the right of your screen. It looks like a chat box, and you can just type them right in there, and we will pose these questions to Sage. While we're waiting for our participants to submit any questions, Sage, what are some of the things that some of the concerns you hear most from women going through metastatic breast cancer, or some of the questions that come up most often?
I think when you're newly diagnosed, the first question that comes up most often is, what does this mean for my life? How long am I going to live? You know, questions that we don't always have answers to. Am I always going to be on treatment? And again, we don't always have the answers to that, but we do have some information around that, and your doctors would be able to answer that. Also questions around, how do I talk to my kids? What do I need to do to prepare to live to the best that I can? Can I travel? Those kind of questions. And again, I would say, great questions. Ask your health care team about that, because every woman and their situation is different. We are doing a fantastic job at treating metastatic breast cancer and giving women a long life with good quality of life, but every case is different.
Sage, it's Stacy.
Hi.
You mentioned during your talk, and thank you so much for such a great presentation. You mentioned for those that are interested in sexual intimacy, the use of lubricants, if vaginal dryness is one of the challenges due to treatment. Do you know what what is the verdict or the research indicating as it relates in particular to women living with a cancer diagnosis about lubricants, water-based lubricants versus other-based lubricants? Is there a recommendation?
Great question. So what we know is that water-based lubricants are great for anyone because you're not usually going to get an infection from that. Silicone-based lubricants are fine as well. They last longer. That's why people like them. But if you're prone to yeast infections, you might just want to monitor that. It doesn't necessarily mean you're going to get one, but it's good to always monitor that. Women can use, if you notice that you're experiencing vaginal dryness, one of the best things you can do is start what I would call your new vaginal health routine. And that would be starting with using 100% vitamin E oil. You don't use it as a sexual lubricant, but you use it as a vaginal health lubricant. You use that intravaginally, so would insert it with your finger in the vagina, and it will help with, again, if you think about the scars on our arms or legs that we use vitamin E to help soften that scar and improve that tissue. It would do the same thing intravaginally. If you're more prone to yeast infections or infections in general, yogurt has also been shown to be very, very helpful and beneficial, and I recommend many women to do that anyways a few times a week. Using organic plain yogurt intravaginally is also a good option. There is some research happening right now on the use of just localized hormone treatment, not hormone replacement, but a hormone treatment there in the vaginal area. And the research is kind of still happening to look at risk versus benefit. I'm hoping that it is in the favor of low risk for any kind of harm. For those who are estrogen receptive, progesterone receptive negative, things like Vagifem are very good options that are localized estrogen replacement that, again, just help with the vaginal area and replacing that. Quite honestly, too, as well, Stacey, women who have been put into a medical menopause and are very vaginally dry, some women go through a conversation with their oncologist about risk versus benefit, and they will initially do, again, a localized intravaginal hormone replacement to help initially regain some of that better healthy vaginal tissue and moisture, and then may stop it as that improves. But they're willing to take the risk of possible, again, it's verdict is out, possible either uterine cancer or localized cancer or affecting the cancer. It just depends. So again, I think that's important to explore with your oncologist and or your gynecologist. If you have vaginal pain, the use of dilators can also be a really great thing. Pure Romance is a website that has a survivorship component on it, specifically for breast cancer survivors, but really any survivor can go to it. They have no hormones in it. They're tested, and very good products. Both they have, again, intervaginal lubrication as well as the basic lubrications that can be very helpful as well. I saw that there was a question, too, about improving sexual health, how you might be able to improve your sexual health. And one of the things, that would be a talk in and of itself, but one of the things that I would suggest is remember that our brain is our most important sex organ. And the part of our brain that's responsible for that is big, and it's not affected by chemotherapy. And sometimes we need to just go back to the basics of getting in our mind and remembering what it was like to be aroused, what it was like to see our body as a whole sexual being, and doing some kind of fantasy or fantasizing and recalling and letting your body respond to those fantasies. Give your body time and recall those times to help improve the way you view your body. Also, therapy can help with doing some visualizations. Getting to know your body through touching it, figuring out what feels good and what doesn't feel good is another really important step to reclaiming your sexual body.
We have a couple of great questions in queue from our participants. The first being around anxiety and fear of not knowing what's next, whether that be, what your treatment is going to bring, or the decision making around whether to continue treatment, and the anxiety that sometimes comes with that.
Yeah, so living with uncertainty is probably the hardest thing about this disease. And we often will talk in my metastatic support group about living in 3-month segments. And some women might perceive that as negative. For a lot of women, it's empowering because 3 months is a time period that you can kind of focus on. And someone will say that we say 3 months because typically in the first couple years at least, you're often scanned every 3 to 4 months. So we will often encourage women as they're living in this uncertainty to plan things to look forward to every 3 months. So if there's a trip you're wanting to take, plan it. Buy trip insurance because there's always a possibility that you get the flu or something else and it's completely non-cancer related that you may not be able to go. But have something to look forward to, a friend coming into town, a concert, that great dinner you've been wanting to go to that costs a little bit more. By having things to look forward to, you're forward thinking instead of being stuck. We can't kind of lift the uncertainty, unfortunately, but I also just encourage women to think, too, about just the reality of life. Life itself is uncertain, and cancer certainly brought that lens into perspective. But remembering that your friends, although their life is just as uncertain, they may not be living in that frame of mind, so be patient with them. But also, again, that's where it's really important to get around women who get it, who can support you in that uncertainty and challenge you to live in the present now and looking forward when you feel stuck.
We have a question from Rhoda who asked, what exactly are the numbers around how common it is for young women under 40 to be diagnosed with metastatic breast cancer?
I wish I could give you that answer, Rhoda. I honestly don't know the statistical numbers. I know that we are seeing a greater and a good, I don't think that it is, at least from the dialogue with my oncologist, I don't think it's because more women are necessarily getting breast cancer, but we are able to identify cancer earlier, and we are also able to identify metastatic disease earlier, so we are catching it earlier and more frequently, so we are seeing it in young women. I don't know if Stacy or anyone else on the call can speak to the actual percentage of young women diagnosed under the age of 40 or, you know, premenopausal. If either of you have those statistics, I don't have them off the top of my head.
So this is Stacy, and it is consistently challenging for us to obtain accurate statistics. I think, you know, one of the challenges is even when we look at baseline incidence rates in breast cancer in general, and the way that American Cancer Society or the NCI through the SEER project capture data, it's different. It has some slight differences which then present different numbers. You know, I've seen numbers as low as 15% to numbers as high as 32%. I think one of the uniquenesses, of course, that we talk about constantly as an organization focused on young women is that they're often diagnosed with more aggressive disease. When some of the researchers are presenting that, they're not saying if that aggression is their initial diagnosis is metastatic, or if it's solely a disease diagnosis that means that the type of breast cancer is more aggressive. So I, like Sage, you know, we don't have a firm number and often get very cautious when we present statistics because we don't want any of our constituents to feel like a statistic. Indeed, it is an individual experience, and we serve a group of women undergoing individual experiences that are very unique. So should we, in the follow-up to this meeting, be able to determine or find statistics that we feel confident in presenting, we'll present them. But it is an ongoing challenge, and I know that that's not what Rhoda wanted to hear. So I'm sorry that my answer was less than stellar.
We have time for a couple of more questions, so just to remind participants, if you have anything you'd like to ask Sage or any of our panelists, please use the question pane that you see to the right of your screen. The next question we have up while you're all doing that is, what are some activities that I can engage children in helping them understand cancer and the changes that that means for their day-to-day life?
That's a great question. So one of the things we really encourage women who have children who are going through this lifelong treatment is to keep their kids' lives as normal as possible. And that may mean that if you have adolescents, that you probably are extremely unimportant in their world and that cancer is not a big deal. And that would be developmentally appropriate. So what we really encourage people to do is focus on the developmental milestones. What is developmentally appropriate for your child, how it is developmentally appropriate for them to respond to your cancer, as well as the information that you give them. So keep their lives as normal as possible. Keep them involved in sports. If that means that you need to have help from friends and neighbors, you explain to them, I want your life to be as normal as possible, and so we're going to need to get some help from friends and neighbors because I might be too tired to pick you up, or I might be in treatment, but I want your life to stay as engaged as possible. And if I can't make it to that game, then I'm going to have somebody take in their phone and Skype me to that game, right? I think, again, showing that you're engaged and involved, even if you can't be there, there are really creative ways to stay involved and engaged with your children, whether that, again, is Skyping into a game to watch if you don't feel like you can get there, or if because the treatment is interfering with your ability to get there, find other ways to be engaged with them. I think helping them understand the changes in your day-to-day life and maybe how they might need to be more helpful would be talking to them about when you feel tired and what might be helpful that they could do to help you feel stronger so that by the weekend you're feeling better, or Tuesday you have time to take them out for ice cream or whatever. So whether that's they may need to pitch in a little bit more by helping fold the laundry, whether that's when you ask them to do something once, it's extra exhausting if you have to ask them 6 more times. Again, they're kids, and they're going to want their life as normal as possible, and the more normal you can make it and their routine be not too interrupted by this treatment, the better they're going to have with just kind of the ups and downs. But again, as your abilities change, the best thing you can do is just keep them informed. Today I'm feeling really tired. The treatment's new. I'm not sure how I'm going to feel for the next few days, so I've arranged some play dates for you. Or I would love it if you had, you know, your friend Tommy come by, but only for a couple hours because I'm just not sure how I'm going to feel, or you're welcome to go over there. And that, again, is where getting your community involved is going to be really helpful and important.
We have another great question from one of our participants who wants to know, how do I balance my privacy with the need for my family and friends to know what's happening with me?
Yeah, gosh, that is a great question and such a tough one. This actually came up when I was doing this a talk similar to this a couple weeks ago, and it is challenging. I think, you know, you have the right to reveal all or none of the information that you want. One of the things that social media, the benefit of social media, is that you can reveal as much or as little as you want as well. And maybe there's an email list of people who you want to know every little detail of, and then there's the email more of the acquaintances or people that maybe would butt in a little too much, that you don't want them to have as much information. And it would be really important that you communicate to them that you don't want this information shared everywhere, that you're communicating this information, and that they need to respect your privacy. The other thing to tell them is just to acknowledge, I know that this affects you too. I know that this is hard for you as well, but I really need for you to respect my privacy and not disclose all this information to people. If you want to put me on a prayer list, that's fine, but please be discreet about the information that you disclose. And maybe you need to give them the language that you're comfortable with them giving. Some people have a mom who's going to get on every, you know, prayer list and church list around the country, and she's going to give the whole story. And that may be overwhelming and unhelpful to you. And so telling your Mom, can you just tell them I have had some changes since my recent scan, and the doctors are doing what they can. We would appreciate their prayers, and leave it at that. Again, I think with family anxiety, the best thing you can do is say, I will keep you informed until something changes, and when it changes, I will keep you abreast of that change. And then, again, keep them informed with any changes, but keeping it, you have the right to as much or as little information as you want. I think, again, when it comes to a partner, if the two of you want different information, they also have the right to request time alone with the doctor, as long as they can respect that they may be getting more information from the doctor than you do, and that they need to respect that you don't want that information. That actually can happen a lot with couples. So respecting that as well, and making sure you're communicating about the boundaries in that would be important.
I think we have time just for one last question, and this has to do with partners, loved ones, spouses. Obviously, they're impacted in different ways, both as your partner, but then also often as the caregiver. And so the question is, what are some good places to find resources so that they feel supported as well?
So I would say that we probably don't have as many great resources for caregivers as we could. I believe that the CSC still has a caregiver group or online support group. Is that correct? Is somebody from CSC still on that can chime in? I think that the CSC is a caregiver group. Oftentimes there are places like, I work for an organization called Life with Cancer. We have a partner support group that is open to any and all partners, that they can come and get support. As I talked about Immerman Angels before, they also will pair caregivers together, and so they can get an individual one-on-one match with a caregiver who's going through a similar situation and get great support. And they can request whether they want that to be a male or female caregiver based off of their preference. So that's also another resource. And then there again, looking for some counseling support. Caregivers get just as overwhelmed as patients oftentimes, and sometimes the caregiver feels uncomfortable disclosing that they're feeling overwhelmed, or they're scared because they don't want to burden the woman with breast cancer. They don't want to burden you with their fears. They feel like if they say it, that it may make you uncomfortable or anxious, and so I think normalizing that they might feel burdened, or that they might feel scared, that they might be scared of you dying, that they might be scared of the treatment, all of that to engage in a conversation, whether that's in a couples counseling session or a family couples counseling session, or even just over dinner, to make that a normal part of a conversation so that they feel like they can talk about that would be important. But again, there are some resources like Immerman Angels, like some of the cancer support communities, or Life with Cancers, or online supports that can provide partner support groups as well.
Great, and thank you to everyone who submitted their questions. And certainly if there's anything that either we didn't get to tonight or if you think of something afterwards, we'll provide contact information, and you also have our websites, and we will be able to answer those questions after as well. Right now we're going to turn the concluding remarks over to Allison Harvey from the Cancer Support Community.
Thanks, Megan. Again, thank you, everyone, for your wonderful enthusiasm and questions. And again, as Megan said, if you didn't have an opportunity to get your question answered, or something pops up after this webinar is over, please, feel free to email us, or also submit the question in the post-event survey. CSC and YSC are here to help you as young women affected by metastatic breast cancer. Again, please remember to visit our websites, youngsurvival.org and cancersupportcommunity.org, for more information for you, as well as Sage mentioned, for caregivers, and for any additional upcoming events or programs. Also, don't forget that you will be able to access the visual recording of tonight's call in the coming weeks. So if you'd like to, go back, if you missed something, we will have it be available both on the YSC and CSC website. Again, also, please don't forget to complete our post-event survey. We really greatly appreciate your feedback, and you will now see a link to the survey in the chat screen to your right. Any feedback you provide will help us in future programs and just being able to better serve you all. And again, that concludes our program for this evening. We would like to thank our wonderful speaker, Dr. Sage Bolte, for helping make this really just a wonderful and successful webinar, and for contributing her time and great insight. And we'd also like to thank our sponsors for this webinar, Bayer Healthcare and Onyx Pharmaceuticals. Again, thank you all for calling in, and we hope you have a wonderful evening from wherever you're calling from. And again, please don't forget to fill out the survey. Thank you.